What's in a day? For over 600 people worldwide, every single day, it's death by drowning. This need not be our future. The United Nations has agreed a historic resolution. July 25th is World Drowning Prevention Day. We can prevent this silent killer through awareness, education, supervision, training, and emergency preparedness. A day to remember loved ones lost. A day we can all mark by practicing water safety in everything we do. Make it your day one. Together, let's bring our drownings down for good.
Yeah, I thought that was a nice video to end that session in, and certainly there's lots of people in the webinar this evening from RNLI. So on behalf of all of us, I'd like to thank RNLI for their significant contribution and the significance of that video. I know everyone in the UK at the moment understands the importance of some of the messaging behind that video, and I certainly congratulate RNLI across the UK and Ireland for some of the work they're doing domestically as well. And we're going to move now to the next part of our webinar. It's a new session. This session is going to focus on the regional context priorities and multi-sectoral action. We have three wonderful speakers in this section, and I'd like to start by introducing the first of those speakers. The first speaker is Professor Olive Kobusingye from Makerere University in Kampala. Professor Olive is a surgeon and injury epidemiologist. She is a senior research fellow at the University School of Public Health, where she heads the Trauma Injury Disability Unit. And she's also a distinguished fellow at the George Institute. So very fine welcome to you, Professor Kobusingye, sorry. I always do that badly, Olive. I'm very sorry. And now I'd like to introduce our next speaker, Dr. Carolyn Lukaszyk from the World Health Organization, Western Pacific region in Manila. Dr. Lukaszyk is a technical officer for preventing violence, injuries, and harmful alcohol use in the Western Pacific Regional Office of WHO, and she's a public health researcher and an injury epidemiologist in her spare time. So welcome to you, Dr. Lukaszyk. Thank you. And our next speaker is Dr. Jagnoor from the George Institute for Global Health. Dr. Jagnoor is a senior research fellow and co-director for the WHO Collaborating Center for Injury Prevention, Trauma Control at the George Institute. So welcome to you, Dr. Jagnoor. A professor, a doctor, and a doctor. So I'm going to get myself tangled up here. So apologies if I don't mean to cause any offense if I get this wrong. We're going to have a discussion, and the idea is that we're going to ask some questions, and we're going to try and generate a little bit of energy around the discussion so that the audience can get a sense of some of the regional context for drowning prevention. So I'd like to start with you, Caroline, if that's all right. And I'd like to just acknowledge the contributions that you've made and many colleagues have made in the regional reports, the Western Pacific Regional Report and the Southeast Asian Regional Report. And I guess my question to you is, what do these reports tell us about drowning and drowning prevention in the Asia-Pacific area?
Thanks very much, Justin, and thank you very much for the opportunity to be here today and contribute to this excellent event. So yes, thank you for introducing your reports as well. I see Stacey's already put links to the reports in the chat. Everyone, I highly encourage you to click on the links and download the full reports and review them at your leisure. There's a lot of fantastic information in there. I think one of the key findings from this report is really understanding the broadness of context of drowning prevention and water safety. So the Southeast Asia region, the Western Pacific region, have the two highest drowning rates in the world. They account for 60% of the total global drowning burden. And as we started collecting data and talking to stakeholders in 30 different member states across both regions, we realized the diversity of risk factors, of different types of interventions available for drowning prevention and water safety. So I think one of the key take-home messages is whether it's traveling on water, living near water, working in or around water, such as fishing, floods, other natural disasters, or bathing, these are all very important risk factors that vary between member states and between regions as well.
And so I was just reading some of the data that was flashed up on the screen. So across the Asia Pacific, essentially we're talking about an issue that's very heavily skewed towards drowning and drowning prevention in children. Is that a true statement?
In the Southeast Asian region, yes, very much so. But in the Western Pacific region, 2019 data shows that actually the highest rates of drowning occur among older people aged 65 years and above.
And Norm Farmer was contacting me on the weekend. We're having a great chat on World Drowning Prevention Day. Most people would know Norm Farmer. And so he was intrigued by the notion that the highest rates of drowning are in the Western Pacific region. Can you tell us a little bit about those very high rates of drowning in this region?
Absolutely. So a bit of background to the region itself. It's an extremely large region. It's a very diverse region. So some of the largest countries in the world and some of the smallest. So we include large countries such as China, Australia, Mongolia, but also small Pacific Island countries. So of course, there's a really big variety of how and when people interact with water across the region. In Pacific Island countries, we saw there were risk factors around drowning included water transport, so small boats being used across long distances to carry families, to carry food, to carry other goods, often in sometimes quite unsafe conditions. In Mekong countries, we have something really so close to rivers, to other sort of natural water bodies as well, really relying on these natural water bodies for food, for bathing, and for drinking water. So again, the context of drowning really differs across the region. We see lots of different risk factors, but I think a lot of these factors work together to contribute to these statistics that we're seeing.
Thanks very much, Carolyn. I mean, it is amazing, isn't it? We've had, in a month or two, we've had a resolution, a World Drowning Prevention Day, 2 regional status reports in the Western Pacific and the Southeast Asian region, and also David released some technical guidelines for swim skills and daycare. So an amazing amount of drowning prevention work just in the last couple of weeks, and certainly in the last couple of days. So congratulations for your reports. We'll come back to you, but I guess having framed drowning and drowning prevention in your region, I'm really interested to go to Professor Kobusingye and ask her, what does drowning look like? What does drowning prevention look like, in fact, in Africa? Is it the same as in Asia? We're not hearing you. Sorry, Olive. Olive, we're not hearing you. We might. Okay, so we might come back to you if you just maybe just check your microphone settings and see whether we can get that working. Are you there now? No, we heard you before.
Is that better?
Well, that's much better. Yeah, that's great. Okay. Good to hear you. So I guess you were responding to the question, Carolyn's outlined drowning and drowning prevention in Asia Pacific. And so the question is, does drowning in Africa look like drowning in Asia?
No, not at all. And in fact, when I first started working on drowning, a lot of the literature that I read was from Asia. And yet the patterns that we've seen in Uganda, in Tanzania, in many other countries that have done studies in Africa, it's markedly different. So the first big difference is the age, the average age of those that are drowning. In countries around here, we tend to see older people, so in their 20s, 30s, even, and early 40s. So we have drownings in the very young children, but that's not the predominant group. The context, Caroline mentioned the context, and this is really critical. In the majority of drownings here, we've tended to see, especially around the lakes and rivers, in the fishing communities, so the context being fishing or transportation on water, so a strong occupational component. And a number of people have mentioned the fact that in the global estimates, drownings in the context of floods or transportation might not be included in those estimates. Here, that would leave out easily a half of the drownings, or a large component of the drownings. We've also tended to see, and this is really important related to making those linkages, is that in the younger children especially, this is fetching water. You know, a very basic activity. Fetching domestic water is a high risk for drowning. So that those that are not in the context of fishing and transportation, the next biggest group is using wells, fetching water from a stream or a well. So the difference is actually quite striking, which makes it imperative that for countries, not just here in Africa, but elsewhere, that we need local data in order to intervene appropriately.
And Olive, so if drowning looks different, what does drowning prevention look like? How much success are you having more recently in Uganda, perhaps, in responding to the drowning prevention problem?
Sadly, I would have to say that drowning prevention is still, there's not a big push yet. We are, doing advocacy, and a number of groups are engaged in survival swim, teaching children survival swimming, maybe improving boating safety. But we really need to be running where others are walking. When it's often said that Africa has the highest rates of drowning, and now listening to the data from Southeast Asia, maybe just thinking about the sheer numbers. But I think we need to be doing a whole lot more, and especially bringing in the various sectors that are implicated. So not just thinking about maybe it's a transportation issue, which it is, but also it impacts fishing. It has to do with provision of water and sanitation, which again is an important linkage to sustainable development goal, that if we make available domestic water, then we can reduce the rates of drowning especially in the very young children. So I think that the face of drowning prevention is still not impressive. We need to work on our data, and especially to understand the circumstances, really the important things that will help us to define our prevention strategies, and then work on these multiple sectors so that we can begin to have drowning prevention, coherent drowning prevention. Becky talks about the need for country strategies and plans. And again, we see very few, I think hardly any, except for South Africa, I don't think we see other countries that have plans and strategies on the continent for drowning prevention.
Thank you very much. I think that's a good segue to Dr. Jagnoor. We start to talk about all of the sectors and the engagement with sectors that we need to work with. Multisectoral action was pretty prominent in the UN resolution, and I've seen it bandied around more and more across my colleagues. So how about you give us a perspective on multisectoral action and what it might take and what it might look like across a diverse set of contexts and regions?
Yeah, thanks, Justin, and great to be here to begin with. Hello, everyone. So yeah, I'm just reflecting on Dr. Medding's, Caroline, and Olive's remarks, and it reminds me of one of my favorite authors and speakers, Chimamanda Adichie, who in a very different context warns us about single story issues, not that they are untrue, but that they're incomplete. And I can see a lot of chat going on about floods and floods across Germany, Turkey, China, Cox's Bazar, and so on. So clearly we are all agreeing on the fact that drowning is diverse and its contexts are diverse. I think the issue then becomes, how do we build consensus and embrace the diversity in the context, stakeholders, and solutions? And how do we get better at telling our story in its entirety in a unifying way? Talking about multisectoral action, it has definitely been a buzzword since UN resolution. And I think endgame for all of us is seeing real reductions in drowning deaths and drowning burden, whether it's Western Pacific, Africa, or Asia. And we might not have set our targets yet, but to achieve that impact, need to bring together art of political science and science of public health. And that's where I start talking about multisectoral action. Embed layers of intra and intrasectorality to multisectorality, and you have a real wicked problem on hand. Wicked not because of the degree of difficulty, but that it needs us to get out of entrenched silo thinking. And silo thinking is purposefully systemic. So an acknowledgement that there is a lot beyond our control as drowning prevention enthusiasts. It would be good to have some examples buzzing in the chat room as well. I think Thailand has done some fantastic work on multisectoral actions and other issues. I'm sure our various stakeholders have achieved similar success within their own communities and on their own issues. Maybe Becky can comment how it's worked across tobacco and maternal and child health. So yeah, let's keep discussing on that. It is a wicked problem.
Well said. It is a wicked problem. Carolyn, can you just respond to Jagnoor's comments? Jagnoor's talking about silos and finding a home for drowning prevention versus working cross-sectoral. Your experience, I mean, we've gone to what, 40 governments in the region over the last 18 months. What's your sense of where drowning is sitting, and is it homogenous? Is it sitting in the same place in each country?
Yeah, thanks, Justin. It's an excellent question. And I'm sure you can anticipate the answer. It's definitely not homogenous. It definitely doesn't sit in the same place in every country. So I think a very interesting finding from the reports is that each country really approaches drowning prevention in a very different way. Some countries, such as Australia, have these fantastic standalone water safety strategies. These strategies are inherently multisectoral. There's different roles and responsibilities for different partners and agencies and sectors. And the strategies really try and demonstrate how everyone should come together to address this one issue. However, other countries may choose to have drowning prevention as a key pillar in a broader injury prevention strategy, a child health safety prevention strategy, whereas other countries place drowning prevention in completely different sectors. It can be within disaster risk reduction or meteorology. So again, this is a very interesting learning activity because it's very, again, drowning is such a broad and complex issue, and it really does depend on priorities at the national level, where there is investment, where there is commitment, where there is energy at the national level, and where best then drowning can actually align or even be integrated into. And that's sort of the approach that we've been investigating now moving forward as well.
Great, thank you. Olive, how about you? So what are the responses from these sectors that you're getting around the table? There's lots of energy from Uganda at the moment. There was all weekend, my Twitter was buzzing with Ugandans sharing infographics and webinars. And I know yesterday there was a really fantastic and very well facilitated webinar yesterday afternoon in Uganda. So, but the question is, are you getting different responses from different ministries on drowning? And then I'd like you to touch, if you can, on the role of the life-saving organisations and whether they're playing a meaningful role in your efforts.
Thank you, Justin. So yeah, lately we've had very good interaction between different sectors, and this started about a year ago when we started developing a national water safety and drowning prevention strategy, and we were very deliberate in seeking out various sectors, including water transportation, policing, search and rescue, education, health, and water and environment. And all these were brought together under the office of the Prime Minister. So it was an overarching organization. And some of them had never thought about drowning, didn't think it was their problem. They thought it was a fisheries problem. Some people thought it was a boating problem. They are not in boating or anything. And it took a while for people to begin to see that it's not any one sector's issue, that it's an issue that has to involve all of these sectors. So we've had different kinds of responses with, some of them taking it up enthusiastically and wanting to really engage with it, and others being somewhat reticent and not quite engaging as much as we'd like to. But I think we've come a long way. And especially under the leadership now of the Ministry of Water and Environment, we see that there's an enthusiasm there, that although it would not initially have been in their mandate, now they see it as a part of their mandate. You mentioned the agencies, especially in the NGO sector, those that are in life saving. These have been actually key because I think they're the ones that keep knocking on doors because they see people drowning. They've made attempts at rescue, and they know they have a good sense of the burden, although they're not in research and they don't have hard data, but they do feel the communities and community responses to this problem. So we've had agencies such as Swim Safe Uganda, Uganda Red Cross, Life Saving, Uganda Swimming Federation, those that ordinarily one would not find around the table with researchers. But we've really worked well with them to do the advocacy and to keep the issue in the eyes of the public. So they've been quite key in the advocacy area, and we would hope that they stay a part of this response moving forward.
Yeah, Jagnoor was talking about the art and the science. I think in many respects, the life-saving organisations, the swimming organisations in the field, they're sort of the heart of the issue in a sense. They're certainly not going to let it go, but they certainly need to increasingly partner with a range of other actors. Jagnoor, I'm going to bring you in now, but I think given the time, we might actually have a look at a really nicely produced video of some work that's going on in West Bengal with some partners. So Will, if we could just play that video now, and then we'll go to Jagnoor.
যাচ্ছে তারা এই যে বন্যা হয়েছে, চারিদিকে তো জল ভর্তি, তারা জলে ডুবে মারা যাচ্ছে, কিন্তু আমাদের সরকারের থেকে কোনো ব্যবস্থাপনা নেওয়া হচ্ছে না। আমরা চাই সেই শিশুদের বাঁচাতে। রোজ
প্রথম কাজ যে পুরো যাদের বাড়িতে শিশু আছে তাদের আশেপাশের পুকুরগুলোকে ঘিরতে হবে, এবং তাদের মা বাবারা যখন বাইরে কাজে যাবে তখন তাদের জন্য একটা ঘর, ছোট্ট মতন ঘর বানানো হবে, যেটা তাদের মা বাবারা কাজে গেলে সেইখানেই থাকার ব্যবস্থা করা হবে শিশুদের, তাদের খাবার জল।
এবং আমরা এটা মনে করি যে বড়রা যারা 18 বছরের ঊর্ধ্বে তারা ভোট দেয় বলে কি তাদের সরকারের প্রতি বেশি গুরুত্ব? সরকার কি তাদের বেশি গুরুত্ব দেয় এই জন্যই? বাচ্চাদের কি কোনো গুরুত্ব নেই, তারা ভোট দেয় না? আমরা এটা নিয়ে প্রচণ্ড প্রতিবাদ জানাচ্ছি যে আমাদের শিশুরা যাতে জলে ডোবা থেকে বাঁচতে পারে, এবং তার জন্য যা ব্যবস্থা নেওয়ার তাই সরকারের কাছে আবেদন করছি যেন তারা সেই ব্যবস্থাগুলো নেয়। নমস্কার।
সাঁতার কাটা একটা জীবনদায়ী দক্ষতা, আমি পারি, তোমরা পারবে তো?
I think you always win the internet with children, right? I think that video was very nicely produced, but if you kind of contemplate the video and the message of the children, the question for you, Jagnoor, is in drowning prevention, Dr. Carolyn and Dr. Olive have been talking about stakeholders and policymakers, and Becky was talking about government. I guess the question is, who matters most in this, and is it actually people in the field?
Yes, absolutely. Communities and the children who are at the brunt of it. So out of 600, if you truly acknowledge that at least 230 children per day are dying due to drowning, so they are at the heart of it. But before I respond to your question, I would like to give full credit to the community and Sini for bringing these young questions together. I'm sure Sini is somewhere there on the webinar, so I just wanted to acknowledge that. And also giving a bit of a background who these kids are. So you can see them wearing masks, and what a resilient community to have been through COVID, not being in school for the last 18 months, and they do not have the luxury and the privilege of internet or homeschooling, and recently been through floods as well. So if the audience does not know, this is the eastern state of West Bengal, and specifically the Sundarbans area. It is the land of Nobel laureate Rabindranath Tagore and was home to Mother Teresa. I saw Caroline smile when we were playing the video, so I'm sure she's having a bit of nostalgia. And I think Becky has been there as well, so she might be thinking about it too. And it is all of that, but these are also the communities with the highest reported child drowning deaths. These are 3 times higher than those in Bangladesh. And I think the data also highlights the need for local data. So if you're talking about the entire India is many countries in one country, and you can say it contributes 19 to 20% of global drowning deaths, but what it is really. So it can be river drowning, it can be flood drowning, it can be coastal drowning, but as we see over here, it is very much child drowning, and the context is very similar to Bangladesh. Here, I would also like to really thank RNLI for giving us the opportunity to do some of the formative work and get this going. Now, knowing these numbers, how do you not act? And I think what Caroline and Becky and Gemma and everyone else has been kind of hinting towards is co-designing implementation strategies with the communities, acknowledging that these interventions would probably look different in everywhere we work in, and it's simply because their contexts are different. And also thinking about co-benefits. So Olive was mentioning about having safe access to water, so piped water. And when we talk about co-benefits, it's thinking about the upstream and the midstream factors. And one of the interesting things, for example, when we think about piped water and sanitation, is also violence prevention. And it's a big issue in India with respect to gender violence prevention. I think there was a fair bit of chat about how do we get governments involved. And to that, we think having prospective policy analysis, so looking at various potential sectors and programs that are already in place and not creating parallel systems. So that there's action research for evidence-informed policies for governments to allocate resources appropriately. And that's what I think brings sustainability. And I think that relates very well to Becky's point on how do we get governments engaged by bringing them in right from the beginning, but also giving them enough to hook on to. As an academic, I think I can keep going for a bit, but I'm mindful, and I'm sure you're also looking at the timer. So I hope we can keep engaging over chat, Twitter, or mail or call. Thank you.
Thanks very much, Jagnoor. Carolyn, you've obviously spent a bit of time in the region, but I guess that just in terms of wrapping this session up, I just want to ask you what do you think the most important things that we need to do as a cohesive sector in the next coming years to be successful and maximize the opportunity of the UN resolution?
Yeah, thanks, Justin. And I think this sort of touches on what Jagnoor has just discussed, but it's really always really eye-opening through the work that we've just completed was the amount of fantastic, innovative drowning prevention interventions already happening in community settings across both regions, led by different sectors, by different partners, by different stakeholders. But if you take this national consultation process and sit down with various individuals working passionate about this issue, you really start to unearth and uncover some fantastic interventions and strategies. So I think a very important thing moving forward is to document and share these and try and realize their transferability and their upscale, because a lot is being done. There should be some more efforts around perhaps coordination and alignment and making sure there are no overlaps or gaps, but it's very important to understand what solutions communities have already identified and are taking, and then be able to, again, share and upscale.
Okay, I think that's a pitch for more regional status reports. I think I see them in your future, John Passmore and a few others, perhaps. Professor Olive, and you, what do you think the sorts of things we really must do in the next couple of years to maximize this opportunity?
Thank you, Justin. So while we don't have the luxury of doing just one thing at a time, and we need to do a number of things all at once, strategies and building multisectoral collaborations, and I think we need to really, in Africa, work on our data. We need to understand the magnitude. We also need to especially understand the risk factors so that we can both intervene appropriately, but also be able to track progress and see if we are making, if we are saving more lives, if we have, so even if we have process indicators and we don't necessarily wait to see whether fewer people are drowning, we do need to set targets. And we cannot set targets unless we have data. And a lot of countries don't have any data, don't know how many people are drowning, where they are drowning, why they're drowning. These are really basic to our understanding of drowning prevention. So I think we need to, while working on strategies, on multisectoral, we do need to work on our data. We need to improve our understanding of both the magnitude and the risk factors, the circumstances around drowning in the region.
Thanks, Professor Olive. And Jagnoor, just some final words from you.
Oh, wow, lucky me. I do get some final words. Thanks, Justin. Well, final words from me. I was thinking about that we have talked about sectors and governments. A call for action for everyone within the audience would be perhaps a starting point. Look around you, look around in your stratosphere and think who the person from another discipline, another sector might be. Who would you like to invite for celebrating World Drowning Prevention Day 2022? Justin, I don't know if I have enough time or not, but I think one of the favorite topics that you have often mentioned is the Global Drowning Prevention Partnership, and would have loved to hear about it if you have time. However, since you have given me the mic, I would like to make another pitch to it. I would hope the champions and leaders within the drowning prevention community take forward the critical lessons from other global partnerships and ensure inclusive, equitable partnerships that are transparent and agile enough to course correct. So yeah, with that, I will hand over to you. Thank you.
Thank you very much, Jagnoor. Good pitch, but we don't have time to get into the global partnership, but thank you very much for the opportunity. You're trying to reverse the interview process. I know exactly what you're doing. I'm going to cop out of that and we'll talk separately on that, I think. But the time is up for this session. Look, it's been a wonderful opportunity to talk to the three of you. So I'd like to thank Professor Olive. Thank you very much for your valuable time and joining us, Olive.
A pleasure.
Thank you. And thanks, Dr. Carolyn. Thank you very much. Keep doing good, great things in the region.
Thanks so much, Justin. Thanks.
And thanks, Dr. Jagnoor. We'll talk very, very soon.